We're here to bring a new type of news show.
New insights, new styles, and new topics every day.
We are News Generation.
Bringing news just for you. It's Thursday, November 20th here in Seoul. I'm Isujin, and this is News Generation. Joining us today is Grace.
Hello, great to be here.
Great to have you. And also Munju's with us.
Happy Thursday.
Happy Thursday. And both are here to speak on behalf of people in their 20s and 30s. So it's Thursday, and so we finally officially passed the halfway mark for the week. And speaking of getting through the week, it got me thinking about how we're all taking care of ourselves, especially now that the weather here in Korea has suddenly turned freezing. So let me ask you, Grace, when was the last time you went to a hospital?
Well, the last time that I was at the hospital was about 2 weeks ago for my monthly OBGYN checkup, since now I'm in my second trimester. I've also been in and out of the Haniwon, or the traditional Korean clinic, to get a more like holistic type of treatment for my neck and shoulder, because I still have some minor pain from a previous car accident. And it's actually very common in Korea for people to visit local clinics and not necessarily bigger hospitals here, since there's great access to them. And most residents are covered by the national health insurance, making healthcare much cheaper than other parts of the world. And while it is the norm in the US, where I grew up, to just go to the nearest pharmacy or grocery store to get over-the-counter meds for your common cold, here in Korea, people just head to the local ENT clinic to get checked out, and then they can actually get prescription medications for the next 3 or so days.
So I'm sure you have friends in the States that have also been pregnant before. So do you feel like your experience is different, or like easier in some ways?
From what I've heard, because my sister, she gave birth in the States, I think I go in for more often checkups.
Oh, you did say it was monthly,
checkups
right?
More often, monthly. I don't know if that's the norm in the States, but then I also have the option to just go in whenever I feel like I need a checkup too. And that's not like a big deal for me. I can just, I don't even have to call. I could just visit the OBGYN and be like, I kind of want to get an ultrasound, and they'll just be like, okay.
But for your sister, she had to make a lot of
I don't think it's as easy in the States.
I see. It's quite interesting. So what about you, Munju?
Yeah, I used to visit the doctor very regularly because of my chronic rhinitis, and also, but recently I had to go in for sinusitis, a direct result of me being too lazy, of not keeping up with the medication that I should have taken consistently. From my personal experience, though, I think medical services here in South Korea is far superior compared to that of the United States. Back in the States, I think I have rarely even thought of going to the doctor or hospital, like no matter how sick I was. It was simply too expensive, too demanding, too time-consuming, and it was very often stressful. So instead, I found myself just stockpiling as many medications as possible at my room. But here in South Korea, I think the system feels efficient and affordable, making it much easier to take care of my health.
So what you said reminds me of my experience in the States too, where, like you said, it's so hard to go to hospital.
Yeah.
You basically cannot go to hospital.
I didn't think about it.
So what I do is I would memorize different parts, different ingredients in the medicine.
Oh,
so
yeah.
There's acetaminophen. That would be helpful. So look at that.
Memorize. I wrote it every single one. Like, this is for cold. This is for a stomachache, diabetes, and stuff.
Right.
Yeah.
And so you would be your own doctor, basically. You would be your own pharmacist.
Yeah, I was pharmacy, basically. Yeah.
Exactly. So we're going to dive deeper into this phenomenon, but first, let's take a look at the screen. South Korea's medical treatment is gaining attention around the world. People from all over the globe come to see dermatologists and plastic surgeons. But it's not just cosmetic procedures that are making headlines. Other areas of Korean healthcare are starting to earn recognition as well. Today on News Generation, we're taking a closer look at these emerging fields, exploring why more international patients and also medical professionals are visiting Korea, and sharing some Korean medical services we personally recommend to our viewers. So as we just saw in the video, Korea's advanced medical treatments aren't just about cosmetic procedures. The country is becoming a trusted destination for a wide range of healthcare services, offering international patients top-notch care and support from start to finish. And Korea has really established itself as a medical powerhouse. In fact, it's not just patients who are visiting, many medical professionals from abroad also come here for training and to learn at Korean hospitals. So I'm curious, what's drawing these international healthcare professionals all the way to Korea, Grace?
Well, Korea's rise to prominence as a medical powerhouse has been possible due to the rapid services that are provided, as well as the lower costs compared to other advanced nations. It's also rooted in the expertise of Korean doctors who have demonstrated their competitiveness in a wide range of fields, from plastic surgery and robotics to organ transplants, especially liver transplants, cancer treatment, digital healthcare, dermatology, and dentistry. As a result, the number of medical professionals visiting Korea from around the world to observe surgeries and learn about the latest surgical techniques and technologies is increasing.
So that really puts things into perspective. It's not just the speed or the affordability, but the actual medical skill that forms the foundation of Korea's reputation. And the range of specialties you mentioned are quite varied, from robotic surgery and organ transplants to cancer treatment and digital healthcare. Really shows how broad Korea's medical expertise is. The fact that overseas doctors are coming here to learn directly from Korean surgeons also says a lot about how advanced the techniques have become. So with all these strengths, Moonju, which fields are attracting the most interest right now?
Yeah, definitely AI-driven medical exchanges are now among the most, popular fields of collaboration here and dynamic fields of collaboration here in South Korea. As a global technology powerhouse, Korea is leading this field. Just this past September, 12 physicians from Singapore, Hong Kong, Chinese Taipei, and Malaysia visited to observe Korea's scar-free transoral robotic thyroid surgery. And that's only one example here. Reports continue to highlight international medical teams coming to learn advanced techniques ranging from, endoscopic spine surgery, artificial joint treatments, and, liposuction techniques, and even traditional Korean acupuncture. So meanwhile, also domestically developed surgical robots are being adopted in multiple countries all around the world and drawing specialists eager to master this specific technology. Korea also extends its expertise through humanitarian efforts, inviting overseas patients and providing free surgeries as part of medical outreach.
So what you said really shows how far Korea has come. It's not just medical treatment, but medical technology and AI-powered techniques that are drawing professionals from all around the world. The fact that doctors are flying in to observe scarless robotic thyroid surgery says a lot about how advanced these procedures have become. And I love that there are also outreach programs offering free surgeries to foreign patients. It also shows a strong commitment to contributing globally as well. So with all this international interest from medical professionals, it's no surprise that the number of foreign patients visiting Korea is also rising. So how many international patients are coming to Korea, Grace?
Yeah, so we can see that last year, the number of foreigners visiting Korea for medical treatment nearly doubled from the previous year, reaching a record high of 1.17 million. In 2020, the number plummeted to around 120,000, of course, due to the COVID-19 pandemic. However, after a three-year recovery period, that number rebounded to about 610,000 in 2023. And then, of course, 1.17 million, the highest ever in 2024. By country, people from Japan, China, the US, Chinese Taipei, and Thailand, in this order, made visits to Korean clinics or hospitals. The most frequently visited departments were the dermatology, the plastic surgery, and internal medicine departments. And industry experts suggest that the growing popularity and trust in Korean cosmetics is actually leading to increased visits to dermatology and plastic surgery clinics in particular.
So that is really an incredible jump. And considering how drastically the numbers dropped during COVID, it's impressive how quickly Korea has bounced back. The fact that dermatology and plastic surgery are still the most visited departments makes total sense, especially with the global popularity of Korean skincare and beauty products. And it really feels like Korea's cultural influence and its medical reputation are kind of working hand in hand. So speaking of culture's influence, we've been seeing more cases where Korean pop culture boosts interest in healthcare as well. So are there specific examples of how Korean dramas or media have impacted interest in certain medical services, Moonju?
Yeah, definitely. Interest in, traditional Korean medicine clinics has surged recently, driven in part by what we so-call these days K-pop demon hunters effect. The Seoul K Medicine Promotion Center, which is used as a model for a clinic in the film, now welcomes around 20,000 visitors a month, nearly tripling its previous number. A 2024 survey on a global perceptions of Korean medical services reinforces this momentum by showing the result of 85% of respondents saying Korean culture really influenced their decision to seek out Korean healthcare. It is a very striking reminder of how powerfully culture can shape interest in even the most specialized areas of the field, which is medical industry.
And it's also fascinating, like you said, how cultural content can drive real-world behavior. We usually think of Korean content influencing fashion or food, but seeing that spill over into healthcare choices, and we see impressive numbers like it's tripling, and it really shows how far that soft power reaches. So to gain more perspective about how popular Korea's healthcare has become, we're going to talk to someone who works at an international clinic. And that conversation will take place right after the break, so don't go anywhere.
NewsGen wants to hear from you. Go to YouTube and search out Channel Arirang News. Click Posts and cast your vote in the poll. Make a new type of news with us.
So joining us today is Subudar, a medical coordinator at the International Healthcare Center. So hello, thank you so much for connecting with us today.
Good morning, and thank you for having me.
Great to have you. So to get right into this, so which medical specialties are the most sought after by international patients?
So I was also looking at the what the Minister of Health and Welfare actually posted, and you also showed on your news channel just now. So although the dermatology, plastic surgery, internal medicine, general care, and health screening services were most sought after, but there is also as well other advancements in what we have, minimally invasive surgeries. So lots of patients would come to that. Back in the day, people used to do gastric cancer removal surgeries by just opening it up, and that was the thing back then. But now it became a lot different. Now we're doing it by endoscopic, microsurgeries. So less risk for the patient, less infection risk, obviously, bleeding risks, and also less scarring on the body. And also, you can say what we saw in health screening services actually helped a lot of international patients. It's not only Koreans that would come to do a health screening and then later find out they had a disease that they were able to catch on early. For example, we had some patients coming in maybe from Uzbekistan or Kazakhstan. Some found out that they had cancer, breast cancer, thyroid, also common bile duct cancer. I mean, these are things you might not know that you would have because you think you're okay, but later on with time, God forbid, it could. So with these health screening services, they would help a lot of people. And also, as soon as we find out these people have these diseases, we connect them to the departments and they get treated immediately. So that's a lot of advancements. And also in AI. AI helped out a lot of patients. You can see also in how we diagnose diseases in looking at radiological images. For example, an AI could actually see in a very, very tiny microscopic things that the human eye cannot sometimes locate. So that's a lot of things that international patients were seeking, the advancements of what Korea has in the medical healthcare.
That's very interesting. Then, Subudar, what would you say are the major strengths of Korea's healthcare system?
So it's renowned by key strengths. I would summarize as diagnostic accuracy and early detection, as I was talking about just now with AI or health screening services. Also minimally invasive surgeries, system efficiency and speed. So the efficiency in Korean healthcare system is another major strength. According to the Ministry of Health and Welfare, 82% of foreign patients in 2024 were treated in an outpatient clinic. So this means faster access to healthcare and with shorter waiting times for consultations and treatment plans. And also cost effectiveness. When I talk about cost effectiveness, we compare it to somewhere maybe hospitals in Europe or in the United States. Comparing it with Korea, for example, major surgeries in Korea would cost 30 to 60% less than in the US. For example, a knee replacement surgery in Korea would cost about 10,000 United States dollars compared to 35 United States dollars in the US. Also, breast cancer surgery in Korea would cost around 3,200 to 13,000 US dollars, compared to 45,000 US dollars. So this is a lot of major things I would see in Korea. The speed, if we say, as soon as a foreign patient would come in, we'd connect him to, let's say, we do an initial evaluation. And through that initial evaluation, we'd find out maybe the patient wants to see other departments. And that happens in a lot of hospitals. So they get connected the soonest, earliest appointments we'd have, also with the tests. Maybe in other countries, you would have to wait for about a month or 2 months just to do one medical test or 3. But in Korea, we can do it in almost about a week or 2, and then we go immediately see the doctor. So that's, cost effectiveness is really a major thing here as well, and speed.
Yeah, I see. Just briefly, what are some things that international patients should get ready in order to receive the Korean medicine treatments or cares?
So I thought maybe at least 5 to 6 things would help out a lot. So obviously, medical records should all be prepared, obviously. Let's say radiological images, CDs, scans of and their results, biopsy results, slides. These are a couple of things I would just talk about shortly. And also appointment confirmation. Just before you leave your country, you should always try and get an appointment in advance, just so you can always do things as soon as you can. Because international foreign patients, they might not be able to stay for a long time. So we do the best we can do, all the hospitals in Korea, and just to get their treatment as soon as possible. And also travel insurance, visa and documentation, financial preparation, cost estimate, getting those from the hospital, cost estimates would be a great thing as well as the travel insurance. And also choosing hospitals that would have major international healthcare clinics. This is a place where I work at, and obviously it would be a good contact point to the patient. We'd know their language, we speak it, we know their culture. It'd be a great help for them as well to go around the hospital. And before they even, do all of these things, they should also as well go to the embassies in their respective countries to find out what type of visas they would need as well. Maybe they would need an invitation letter from a hospital. These are some of the things that foreign patients would need. And also, this is just a bonus point. Maybe when arriving in Incheon International Airport at Terminal 1, there's a Medical Korea little office that would help patients sometimes, or people who just came for travel, but they just all of a sudden wanted to know if they can do some plastic surgeries or do some medical checkups. They would go to that office and ask them around what type of hospitals Korea would have to help them out in that, thing.
All right, thank you so much for giving such thorough answers. I'm sure what you said will be really helpful for any international patient that's planning a visit to Korea, so thank you.
Thank you very much for having me.
So we just heard from someone who works in an international clinic about which medical fields international patients prefer, what they see as the biggest strengths of Korea's healthcare system, what patients should prepare before coming for treatment. So we also want to know what you think as well. So we asked on the Arirang News YouTube channel, besides dermatology and plastic surgery, which area of Korean medical care is of the most interest to you? So here's what the results showed. So when it comes to why international patients visit Korea, comprehensive health checkups lead the way, accounting for 50% of visits. Traditional Korean medicine attract 22% of patients, while dental treatments follow at 19%. And treatment for major illnesses such as cancer made up 9% of the visits. So it's interesting to see that comprehensive health checkups make up half of all visits. It really shows that people are coming to Korea not just for treatment, but for preventive care as well. And dental treatments and hanbang treatments are also surprisingly popular, which tells us that Korea's expertise in both modern and traditional medicine is being recognized globally now. So Grace, having lived in the US and experienced the healthcare systems of both countries, which type of treatment in Korea would you personally recommend?
Well, like we saw in the polls, other than getting the comprehensive physicals, as well as visiting the Korean traditional medicine hanbang clinics, I recommend, well, I don't really recommend, but I would say that if you go to internal medicine or ENT clinics, you can see that IV drip therapy is actually offered pretty often, which is basically a cocktail of vitamins, antioxidants, proteins, and minerals that are administered directly through your veins, making their effects really rapid. So yeah, these IV drips are mainly offered to relieve chronic pain, fatigue, even hangovers, at a lower cost than what I would see in the US. And if you, of course, decide to get it here, it's much easier to find, it's cheaper, and it is a unique medical treatment that many Koreans make use of.
And there's such a wide variety of options there as well for IV treatments. So what about you, Munji? What are your thoughts on this?
I completely agree with Grace, and just to add on, health screenings stuff, they are very specialized here in centers in South Korea. So you could use one, or again, the hanbang, its origin here is definitely South Korea. So you could be introduced to new and unique treatment that's completely different from the conservative medical cares.
I agree. So Korea is no longer just a destination for beauty treatments. It's a global medical hub where technology, expertise, and culture come together. And its reputation as a medical leader comes from a combination of skill, innovation, and care. So whether you're curious about preventive checkups, cutting-edge surgeries, or even traditional Korean medicine, Korea's healthcare system is offering more options and even more access than ever. And with its international patients seeking treatment or medical professionals coming to learn, it's clear that Korea's healthcare system will continue to grow in importance. So that brings us to the end of today's episode of News Generation. But News Gen will be back tomorrow with more stories and discussions. A big thanks to Grace.
Thank you for having me.
For coming in, and also Munju.
My pleasure.
And to our viewers, thank you so much for joining us today, and we hope you have the best day. We are News Generation.